Hello, this is Miss Page, and this lecture will be covering nutrition and metabolism. Nutrition is the sum of all processes involved in taking in nutrients and using them to maintain body tissue and provide energy. Good nutrition is essential for optimal health throughout all stages of life. The nurse must consider the patient's nutritional state and evaluate the patient's nutritional history to plan quality patient care. The LPN might be responsible for assisting a patient to eat, recording a patient's intake, observing a patient for signs of poor nutrition, and communicating dietary concerns to the healthcare provider, dietitian, or other members of the healthcare team. There are different diet planning guides available. One being My Plate, which is a plate that's divided into sections showing how much people should eat from fruits, vegetables, grains, protein, and dairy. This helps reduce portions, increase intake of fluids, vegetables, and whole grains, and helps reduce sodium and sugar. There are also the dietary guidelines for Americans. This focuses on healthy eating patterns as a whole rather than on individual nutrients or foods intended to help people choose an overall healthy diet. The dietary guidelines for Americans are used to form the U.S. federal nutrition policy, and it directly affects federal nutrition programs such as food stamps, school breakfast and lunch programs, and special supplemental nutrition program for women, infants, and children, or otherwise known as WIC. A dietary reference intake is a set of nutrient-based values for evaluating and planning diets. This is a combination of recommended dietary allowances, or RDAs, adequate intake, tolerable upper intake level, and the estimated average requirement of each nutrient. The purpose of this is to help avoid consuming too much of a nutrient and optimize health and prevent disease. Finally, the nutrition facts label. The FDA mandated that all nutrition facts label be included on all packaged foods, and the restaurants have to make this information available to patrons. The ingredients listed on the label are in descending order by weight, so the first ingredient has the most weight in the food. The label also has to include calories from fat, total amount of fat, saturated fat, trans fat, and cholesterol. Essential nutrients are nutrients that the body cannot make in amounts essential for good health, so they must be obtained through the diet. These include carbohydrates, fats, proteins, vitamins, minerals, and water. The major functions of essential nutrients are to provide energy, build and repair tissue, regulate body processes. When they provide energy, a kilocalorie or kcal is a measurement of energy. So if a food has X number of kilocalories, it provides that amount of energy. Only carbohydrates, fats, and proteins will provide energy. Carbs and proteins provide 4 kilocalories per gram, whereas fat provides 9 kilocalories per gram. 45% to 65% of daily kilocalorie intake should be from carbohydrates, 20% to 35% should be from fat, and 10% to 35% should be from proteins, and this is called caloric distribution. Building and repairing tissue. Protein plays the biggest role in building and repairing tissue. Proteins contain amino acids that the body uses to build and repair that tissue. Fat also plays a role because fat is found in all cell walls. Regulating body processes. Metabolism is the combination of all chemical processes that take place in living organisms. It's the continuous process of building and breaking down tissues. Nutrients play various roles in metabolism. Let's get a little bit more in depth into carbohydrates. So the main function of carbohydrates is to provide energy. Carbs are classified as simple or complex. Simple carbohydrates are further divided into monosaccharides and disaccharides. Monosaccharides is one sugar unit, and it's absorbed directly into the blood, for example, fructose and glucose. Disaccharides are two sugar units bonded together. Once they're in the body, they're then broken down into monosaccharides. Example of disaccharides is table sugar or sucrose and lactose or milk sugar. Complex carbohydrates are divided into polysaccharides, which are then divided into starches, glycogen, and dietary fiber. So polysaccharides are made up of long chains of glucose. Starches are found in many plant foods such as grains, legumes, and starchy vegetables like corn and potatoes. It breaks down more slowly and provides energy for a longer period of time. Glycogen is the stored form of carbohydrates. It's made from simple sugars, and it's stored mainly in the liver and in the muscles, and it's used when the body's glucose levels are low. Dietary fiber are in foods that humans cannot break down. Most fiber is excreted in the feces, and it has no nutritional value, but it helps provide bulk, which helps lower cholesterol, blood glucose levels, and helps in weight loss. Dietary fiber is further broken down into insoluble fiber and soluble fiber. So insoluble fiber softens the stool, speeds transit of foods through the digestive tract, and reduces pressure in the colon. This can help relieve constipation and reduce the risk of GI disorders. Soluble fiber binds with bile acid and cholesterol in the GI tract to prevent their reabsorption. So soluble fiber helps lower cholesterol levels and reduces risk of cardiovascular disease. It attracts water and turns to gel, which helps slow digestion. This can be helpful in weight loss because it gives the illusion of feeling full. Again, 45 to 65% of total calories should come from carbohydrates per day. Fiber intake should be between 25 and 38 grams per day. At least half of all the grains that are consumed should be whole grains, not refined. Sudden increases in fiber can cause bloating, gas, and constipation. So slowly increase fiber intake and add at least 8 glasses of water a day to help offset that bloating, gas, and constipation. Digestion and metabolism of carbs. So enzymes from the intestines and the pancreas aid in digesting carbohydrates. They're broken down into monosaccharides before they are absorbed and converted to glucose. The glucose enters the bloodstream and is used by cells for energy. Any extra carbs are converted to glycogen, which is stored in the liver and muscles until needed. And when the liver and muscles are full of glycogen, the body then converts the remaining carbs to fat and stores them as adipose tissue. Diving a little bit deeper into fats. So you can go ahead and say that lipids are the same thing as fats and cholesterol. Lipids are insoluble in water. They provide the most concentrated source of energy of all nutrients, and they provide 9 kilocalories per gram. They can be used either directly from the fat in foods or from adipose tissues. Adipose tissue helps insulate the body from temperature extremes and acts as a cushion to organs and other tissues. Dietary fat provides satiety, which is the feeling of fullness and satisfaction from food. It also helps add flavor and aroma to foods. Lipids contain fatty acids and glycerol. They are also called glycerides or triglycerides. Fatty acids are building blocks of fat and are classified as saturated or unsaturated. Saturated fatty acids are when chemical bonds are saturated or filled completely with hydrogen. Generally, saturated fatty acids are going to be of animal origin and solid at room temperature. These tend to increase blood cholesterol, which increases atherosclerosis and the risk for heart disease. Unsaturated fatty acids are when one or more places on the chain have hydrogen missing. Most unsaturated fatty acids come from plant sources and are liquid at room temperature. These are thought to lower LDL, or the lethal cholesterol. Trans fatty acids are unsaturated fatty acids that have been completely hydrogenated, so they've been turned into saturated fatty acids. These are similar to your saturated fats and tend to increase blood cholesterol levels. Cholesterol is the building block for cell membranes and hormones. Cholesterol is synthesized in the liver and found in foods of animal origin. Dietary cholesterol are highest in organ meats and egg yolks, but smaller in seafood, meats, poultry, and dairy. The recommended intake of cholesterol is less than 300 milligrams per day, and decreasing the amount of animal fats helps decrease the amount of dietary cholesterol consumed. Digestion and metabolism of fat. So fat must be emulsified or broken down into smaller globules. Bile helps emulsify fat, and then the body can break them down and absorb them. Once absorbed, lipids are packaged as lipoproteins, which help transport lipids in the bloodstream. There are 4 types of lipoproteins. Chylomicrons, high-density lipoproteins, HDL, low-density lipoproteins, LDL, very low-density lipoproteins, or VLDL. So we'll talk a lot about LDL and HDL, and these are what carry cholesterol in the bloodstream. LDL increases the risk of atherosclerosis by contributing to the plaque buildup on the artery walls. You can think of LDL as the lethal type. HDL transports cholesterol from the bloodstream to the liver to be excreted, and you can think of HDL as the healthy type. Total serum cholesterol should stay below 200 milligrams. And when you're teaching a patient about cholesterol, it should be aimed at reducing LDL, the lethal type, and increasing HDL, the healthy type. LDL is lethal, so you want low amounts, below 130. HDL is healthy, so you want higher amounts, above 40 for men and above 50 for women. Increasing seafood can help when you replace cholesterol-containing meat and poultry. So instead of eating meat and poultry, replace it with seafood. Replace higher solid fats with ones that contain unsaturated fats, and use oils instead of solid fats when possible when cooking. Proteins are essential for tissue growth, repair, and wound healing. Some examples of protein are collagen, thyroxine, insulin, albumin, and hemoglobin. If necessary, the body can use protein for energy. It provides 4 kilocalories per gram. If protein is being used for energy, then it isn't being used for tissue growth. Amino acids are the building blocks of protein. There are 9 essential amino acids, and they must be obtained from the diet. 10 to 35% of total calories come from protein. Stress and illness can increase this need for protein. Complete protein is one that contains all 9 essential amino acids in sufficient quantity and ratio. Examples of complete proteins are meat, poultry, fish, milk, cheese, eggs, and soy products. Incomplete protein lacks 1 or more of the essential amino acids. Usually, incomplete proteins are of plant origin. Some examples are grains, nuts, and seeds. Vegetarian diets can pose an issue with consuming sufficient amounts of protein. A reliable source of vitamin B12 is also important in vegetarian diets because vitamin B12 is found strictly in animal foods. So your patients that are on vegetarian diets might need a supplement of vitamin B12. Digestion and metabolism of protein. Protein-containing foods are the body's only external source of nitrogen. Nitrogen balance is achieved when the amount of nitrogen or protein taken in is equal to the amount of nitrogen excreted in the urine. A positive nitrogen balance is when more nitrogen is taken in than is excreted. The body is building more tissue, or anabolism, than breaking it down. This is seen during periods of growth, such as infancy, childhood, adolescence, and pregnancy. Negative nitrogen balance is when less nitrogen is being consumed than excreted. the body is breaking down more tissue, or catabolism, than it's building. This is seen during undernutrition, illness, and trauma. Prolonged negative nitrogen balance can eventually cause atrophy of the muscles and poor functioning of body systems. When protein is consumed in amounts greater than the body needs, amino acids are converted to fat and stored in adipose tissue. High protein diets are usually high in saturated fats, which increase the risk of cardiovascular disease, and too much protein can cause excessive burden on the kidneys and lead to renal failure. When there is a lack of energy or protein intake, protein energy malnutrition, or PEM, can occur. It's common in children and adults in developing countries and can lead to stunted growth, impaired cognitive development, reduced mental and physical capacity, and lowered resistance to infections. There are two types we'll talk about, marasmus and kwashiorkor. Marasmus is protein deficiency characterized by wasting of the body tissues. This affects all ages, and as the disease progresses, subcutaneous fat stores and then muscle stores are depleted. They have a skin and bones appearance, and you can see that example of marasmus on the left-hand side picture. Kwashiorkor is severe protein restriction in the presence of other calories. Most often it's in children, usually starting when the child is weaned from breastfeeding. You'll see edema in the feet, legs, face, and hands, and there will be swelling in the abdomen from low albumin and enlarged fatty liver. So this child will appear fat, and the parent will think that the child is well fed, but they're actually having a problem with the amount of protein that they're receiving. Next, we'll move on to vitamins. Vitamins are essential in small quantities for normal metabolism and growth and maintenance of the body. These are also known as micronutrients because a small amount is needed. Vitamins are classified by whether they are soluble in fat or water. Fat-soluble vitamins are A, D, E, and K. These can be stored in the body, similar to fats, and too much can cause toxicity. Water-soluble vitamins include B and C, and these cannot be stored in the body because they are water-soluble, so they tend to be excreted in the urine, and a daily intake is needed. Antioxidants include vitamins E, C, and A. These have been found to delay or prevent the destruction of cell membranes in the presence of oxygen, and helps reduce the risk of developing certain cancers, inflammatory disease, Alzheimer's, and heart disease. Vitamin C, or ascorbic acid, contributes to healing of wounds, burns, and fractures. It's also an antioxidant, and it's necessary for adrenal gland function. Vitamin C can be found in citrus fruits, green, leafy, and yellow vegetables. A deficiency of vitamin C can result in bleeding, easy bone fractures, poor wound healing, and anemia. B-complex vitamins include niacin, folate or folic acid, and vitamin B12. Niacin is important in the production of energy from glucose, and it's involved in repair of DNA. Niacin can be found in meat, poultry, fish, peanuts, enriched whole grain breads, and cereals. Folate or folic acid is necessary for formation of DNA and proper cell division. Folic acid is the synthetic form of folate, but both forms work the same in the body. The synthetic form is just easier to absorb. It's found in spinach, lentils, and garbanzo beans, beets, oranges, kidney beans, and green leafy vegetables. Deficiency can lead to megaloblastic anemia, and adequate folic acid intake before and during pregnancy has been found to reduce the risk of neural tube defects in the infant. Vitamin B12 assists in the production of hemoglobin and myelin. Vitamin B12 is found in foods of animal origin, so vegetarians and vegans are recommended to take an oral supplement. Vitamin B12 can also be found in lean meat, liver, seafood, eggs, and dairy products. Vitamin B12 injections are also available if the patient cannot absorb oral vitamin B12. Vitamin A is available in two forms, retinol and keratin. Vitamin A is needed to maintain vision, skin, and bone growth. It's found in bright yellow and orange fruits, carrots, pumpkins, dark green leafy vegetables. Vitamin D promotes the absorption of calcium and phosphorus, which promotes tooth and bone health. It's found in fortified dairy products, yeast, fish, liver oils, and sunlight. Too much vitamin D can lead to GI upset, muscular weakness, and calcium deposits, but deficiency of vitamin D can lead to osteoporosis. This is common in older adults who don't go outside as much and don't drink dairy. And people that don't drink dairy are also of special concern. Vitamin K plays an important role in blood clotting. There are two forms of vitamin K. One is present in dark green leafy vegetables, and the other is made in intestinal bacteria. Patients who are taking anticoagulants should consume consistent amounts of vitamin K per day. Large fluctuations have the potential to alter the effects of anticoagulants. On page 533 to 534 in your book has a chart of vitamins, functions, and signs and symptoms of toxicity or deficiency. Minerals help regulate bodily functions without providing energy and are essential to good health. Minerals can be classified as major or trace. Major minerals are needed in more than 100 milligrams per day. These include calcium, phosphorus, magnesium, sulfur, sodium, potassium, and chloride. Trace minerals are needed in smaller amounts, so less than 100 milligrams per day. These include iron, zinc, iodine, selenium, copper, manganese, fluoride, chromium, arsenic, boron, nickel, and silicon, and these are lesser known minerals. Calcium is important in the formation of bones and teeth, blood clotting, transmission of nerve impulses and muscle action, metabolic reactions throughout the body. Calcium is necessary to protect against osteoporosis, which is the abnormal reduction in bone density. This can lead to bone pain, fractures, loss of stature, and deformities. The recommended intake of calcium varies among age groups, but it can be found in milk, cheese, milk products, fish with bones, orange juice, breakfast cereal, and calcium supplements. Sodium functions as an electrolyte in the body and is needed in small amounts for good health. Dietary sodium deficiency is very rare in the U.S. Excess sodium is more common, and it can be really detrimental to health. Salt is the largest contributor of sodium in the diet. Large amounts of salt eaten can lead to hypertension or high blood pressure and edema or swelling. 1,500 milligrams per day is the recommended amount. The upper limit is set at 2,300 milligrams per day, but most adults in the U.S. consume somewhere around 3,400 milligrams per day. Sodium can be lost in heavy sweating, diarrhea, vomiting, and renal disease, so watch these patients carefully. Processed foods usually have added salt, so in order to reduce the amount of salt, the patient might need to reduce the amount of processed foods and eat more foods in their natural state. Potassium is needed for conduction of nerve impulses and contraction of muscles, including the heart muscle. Severe deficiency of potassium or hypokalemia, when blood potassium levels are less than 3.5, is life-threatening. Potassium is found in fruits, vegetables, and milk. Iron is an essential part of hemoglobin, myoglobin, and other enzymes. Hemoglobin carries oxygen to the cells, and myoglobin is responsible for storing oxygen in the muscles. So if we don't have enough iron, then we don't have enough oxygen for our cells and muscles. Lack of iron can cause iron deficiency anemia, which is the most prevalent nutritional problem in the world. And again, deficiency of iron limits oxygen delivery to the cells. Iron is found in meat, specifically organ meats, poultry, fish, whole grains, and soy foods. Taking vitamin C with iron supplements may enhance the absorption, but taking iron with fiber and coffee may inhibit absorption. Vitamin and mineral supplementation. Many people believe that if some is good, then more is better, but that's not the case for vitamins and minerals. Vitamins and minerals are best obtained from a balanced, varied diet. Supplementation is only necessary in some cases, and usually a multivitamin is fine. Water is most vital to life. Humans can survive longer without food than they can without water. Water makes up approximately 60% of the adult body weight and 80% of the infant weight. It provides form and structure to body tissues, acts as a solvent, and it's necessary for most chemical processes. It helps transport nutrients and other substances throughout the body. It lubricates and protects moving body parts. It aids in digestion and is necessary for regulating body temperature. Dehydration occurs with abnormal losses of water, such as vomiting, hemorrhage, burns, or increase in perspiration or urination. Severe dehydration is more than a 10% loss of body weight in water, and this is life-threatening. Signs and symptoms include poor skin turgor, flushed dry skin, dry mouth, cracked dry lips, decreased urine output, irritability, and disorientation. In infants, sunken fontanelles, decrease in wet diapers, and no tears when the child cries can signal dehydration. Infants are at a greater risk of dehydration because they are more susceptible to greater skin losses of water, and older adults are also at risk because of decreased sensitivity to thirst. 80% of total water intakes comes from drinking water, and 20% comes from water contained in foods. 9 to 13 cups of water a day is adequate for most adults, which is around 2 to 3 liters. But pregnant and lactating women might need up to 3 liters a day. When working with patients with GI illnesses, they might have an order from the doctor for different diets, and those diets we'll cover today. A clear liquid diet is non-irritating. It consists of liquids that are easily digested and absorbed. They leave little waste or residue in the GI tract, and little stool is formed. This is typically used before diagnostic procedures and before surgery. It can be used post-operatively until peristalsis returns, or the movement of the intestines moving stool through the body. It can also be used during episodes of diarrhea or vomiting, and it should be used temporarily around 2 to 3 days because it's low in calories and protein. Clear liquid diet includes liquids that you can see through, so apple juice, white grape juice, fat-free broth, plain gelatin, tea, or black coffee. A full liquid diet is a transition diet from clear liquid. It has more nutrition than clear liquid, and it can include ice cream, creamy soups, gelatin, pudding, milk, and juice. A soft diet, or pureed or mechanical soft, is low in fiber and similar to a regular diet. It includes foods from all food groups, but strong spices are avoided. This can be ordered for patients who have difficulty chewing or swallowing because the meats are ground up and the fruits and the vegetables are cooked and then pureed. A high fiber diet is used in treatment of constipation. It'll include whole grains, fresh cooked or raw vegetables, and fruits. And this is increased slowly, again, because it can cause gas and bloating. Carbohydrate modified diet. This is often used in diabetes because carbs break down into glucose, so diabetic patients need consistent carbs and meal timing. A low-fat diet is used in prevention and treatment of atherosclerosis, heart disease, and hyperlipidemia. In low-fat diets, the unhealthy saturated fats and trans fatty acids should be substituted with the healthier unsaturated fats. A fat-controlled diet is used to treat symptoms of diarrhea, steatorrhea, and flatulence or gas, or to treat diseases of the pancreas, intestines, or lymphatic system. No visible fats are allowed, and only non-fat dairy products are included. Protein restricted. You might see this in chronic renal failure and cirrhosis patients. The kidneys are unable to excrete protein waste products in renal failure. And cirrhosis can cause elevated ammonia levels, and protein should be limited if the ammonia level is high. Sodium restricted diets. These are most often used in treatment of hypertension, high blood pressure, or heart failure. The DASH diet, or dietary approaches to stop hypertension, might be used. Again, we recommend 1,500 to 2,400 milligrams per day. And this sodium-restricted diet can also be used in cases of water retention or edema, because wherever sodium goes, water goes. So if we want to decrease the amount of water in the body, we decrease the amount of sodium. Potassium modified diet. There can be an increased potassium, which can help control blood pressure. There can be decreased potassium used in renal disease and other kidney disease, because potassium is retained in renal failure. The kidneys can't filter out that potassium. Fluid modified diet. A fluid restricted diet might be seen in end-stage renal disease, congestive heart failure, or after a myocardial infarction or a heart attack, because we need to control the amount of fluid that's in the body. They might be restricted to 500 to 750 mLs, or 2 to 3 cups, plus the amount of urine output. Fluid restriction is divided between the nursing staff and the dietary department. So the dietary department might only be able to give the patient 600 mLs on a meal tray, and the other 400 is going to be up to the nursing staff if the patient is at a 1,000 ml fluid restriction per day. The patient will experience excessive thirst, so offer rinsing the mouth out with cold water, freezing fluid so that it takes longer to consume, eating cold fruits and raw vegetables, chewing gum, hard candies or mints, brushing the teeth often, and limiting sodium intake. Increased fluid intake is common for renal calculi or kidney stones or urinary tract infections, because this helps dilute the urine and increase urinary output. Might also be needed during diarrhea, vomiting, malabsorption, or burns once the bowel function returns. Enteral nutrition is administration of fluids into the GI tract through tube feedings. A tube feeding is administration of a nutritionally balanced liquefied food or formula through a tube inserted into the stomach, duodenum, jejunum by a nasogastric tube or ostomy. Tube feedings are indicated for patients that can't chew or swallow, maybe after oral surgery or facial trauma, when a patient has no appetite or refuses to eat, in times of great nutritional needs such as burns or trauma, comatose patients, or diarrhea and moderate malabsorption. Tube feedings are used only when all or part of the GI tract is functioning. Patients that require long-term feedings will usually have feeding ostomies, which are surgical openings through which a feeding tube is passed. And the name depends on where it's placed. So a gastrostomy is placed in the stomach, a jejunostomy is placed in the jejunum, etc. Types of feedings with enteral nutrition. There is continuous feedings, which is a continuous drop pump that administers formula over 16 to 24 hours. Intermittent feedings, which are specific volumes of formula given over a short time period, usually 20 to 30 minutes, and that's done 4 to 6 times a day. Or bolus feedings, which is a large amount of formula administered in a matter of minutes, but most patients don't do well with this. Complications of tube feedings, abdominal distension, diarrhea, nausea. This might indicate the formula strength, volume, or rate is too high. Dumping syndrome, infection, aspiration, which is when food or fluid enters the lungs, overhydration or dehydration, electrolyte abnormalities, and glucose abnormalities. Nasogastric tube feedings. A nasogastric tube is a tube that's inserted through the nostril, through the esophagus, and into the stomach. Always check placement prior to administering medications or feedings. An improperly placed nasogastric tube can cause aspiration, pneumonia, a pneumothorax, or peritonitis. The most reliable way to check placement of an NG tube is a chest x-ray. The next reliable is by aspirating gastric contents and testing the pH. And finally, the oscillatory method, which is when you connect a syringe and push air into the tube and listen at the same time with your stethoscope over the stomach for a swooshing sound. This can sometimes be confused with air being pushed into the lungs, so it's not to be used as the only confirmation of tube placement, especially after the initial insertion of an NG tube. You should always have a chest x-ray, and then after you have had the chest x-ray confirmed that the NG tube is in the right spot, you can use the oscillatory method. Parenteral nutrition, or hyperalimentation, is intravenous feedings, usually composed of glucose, amino acids, vitamins, minerals, and electrolytes, individualized for the patient. And fats can also be given, but these are given separately. So this intravenous feeding is given through a peripheral vein, an arm or leg, or a central vein. If it is given through a peripheral vein, then it is called peripheral parenteral nutrition, or PPN. If it's through a central line, then it is called total parenteral nutrition, or TPN. A central line is a catheter that's placed into a central vein, usually the subclavian vein, into the superior vena cava. You can see that in this picture. So a central line is any catheter that's placed into a central vein, and a central vein means it goes directly to the heart. Parenteral nutrition is indicated for patients that have non-functioning or dysfunctional GI tract, if they need 3,000 kilocalories a day, if they need supplementation to an oral diet, or they require short-term therapy. Patients who receive TPN should be monitored for electrolyte imbalances. The big thing is to watch blood glucose levels, because blood glucose levels can increase with parenteral nutrition. Should also watch their blood chemistry, such as electrolytes like potassium, sodium. Feeding the patient, this might be a review from Nurse Aid. You want to make sure to create a relaxed mood and don't rush the patient. Allow for before meal rituals such as praying or washing their hands. Make sure the temperature of the food is correct. Use a spoon when feeding the patient, don't use a fork. Ask what order they want their food in. Give them small bites and allow for chewing and swallowing. Allow patients to feed themselves as much as possible. Always tell the visually impaired patient where food is on the plate like a clock. So this picture, for example, you would say the baked potato is at 12 o'clock and the bread is at 9 o'clock. You also want to make sure that you're sitting facing the patient, and you want to sit down with the patient, don't stand over them. So that is all I have as a review of nutrition and metabolism. If you all have any questions, please feel free to shoot me an email or save a question for the Q&A.